In this video, I want to talk about the antipsychotics. Before we get started on the drugs, we should have an understanding what is psychosis. So psychosis in a one-liner is a loss with reality. So your brain tells you things and you don't know if it's real or not. And psychosis is a symptom, not a disease by itself. So it can be associated with many diseases. And the most common form of psychosis is schizophrenia. And schizophrenia presents with so-called positive and negative symptoms. So the positive symptoms are things, characteristics that you add to someone's personality, and they can be remembered as the 4 Ds. D for delusions. So these are false beliefs. If I tell you I won the Nobel Prize over and over again, and everybody else says, no, you didn't, that's a delusion, it's a false belief. Auditory hallucinations could be any type of hallucinations, but auditory is the most common. So hallucinations are perceptions when there's nothing to perceive. So if I hear voices in a quiet room when there's nothing, that's an auditory hallucination that talk to me and tell me to do stuff. So perceptions when there's nothing to perceive. And then we have also disorganized speech. And that's fairly easy to recognize because people are usually pretty good with telling a story from A to Z. And a patient with schizophrenia may jump a lot around, so it's very hard to figure out what happened. And disorganized behavior is just odd behavior. So these are the 4 Ds for the positive symptoms. And then there's also negative symptoms. So things that you take away from someone's personality. Usually people are pretty social, but patients with schizophrenia will show social withdrawal. So it's going to be hard to get them to do stuff with other people. They don't want to hang out socially. Also, there's a so-called flattened effect. So that means usually we show emotions on our face. You can see if you are happy or sad. But flattened effect means that there's no emotions on the face, so it's flat. And then there's also no motivation, a lack of motivation. Usually people are motivated to do stuff, but these negative symptoms take away from someone's personality, so they don't have any motivation to do stuff, lack of motivation. This is just simplified what is psychosis and what is schizophrenia.